Dr. Gorden, what is personalized medicine?
All right, so if you go to seek medical care, I imagine that you're going to get personal care.
You hope.
You're right.
Yeah.
Focused on not just your medical problem or physical issue, but your social background, psychological state. Take all that into account. What I want to distinguish that is from personalized medicine for oncology or blood disorders, where now you're doing a deeper dive into, say, your genetic background, or if you have a cancer, the tumor's kind of biology.
Okay, so why is personalized medicine so important, especially when it comes to cancer?
I think before we always had a one size fits all to some of our cancer treatments or blood disorder treatments, and they're toxic or they have a lot of unintended consequences. And maybe we were doing too much or not enough, and this is a way to really understand the tumor, the person, and give a treatment that will be more effective, maybe better tolerated, and improve the outcome.
And how is this practiced?
So for many places, it starts in the community, just being awareness, maybe recognizing patterns in family where cancers develop or seem to be more prevalent. We've had religious leaders kind of do marriage counseling and find in the background of the families there might be increased risk there. We do have very specialized clinicians who are medical geneticists that can do these extensive family histories.
Wow.
Do these very in-depth physical examinations and find very subtle changes that might point to an underlying genetic condition. For us in our community setting here at the hospital, we have a full team between clinicians, the intake nurses, tumor registrars who are first in line when things get diagnosed or labeled as a cancer, and genetic counselors that can help make sure that we're screening kind of everyone who comes in with a cancer diagnosis to make sure we're labeling that tumor appropriately, finding out all the details, so then we can know our full treatment array right at that time.
Wow. Okay, and then give us an idea too of what are some of the most common illnesses that you treat preventative medicine with?
Well, I'd say it's not maybe a new thing, but it's certainly getting the label and getting some attention now. But even breast cancer, we've kind of known what's driven that for the last 50 years. We think of hormone status of these breast cancers, estrogen, progesterone, and certain growth factors we called HER2. And once we've identified these, we can tailor the treatment appropriately. Maybe perhaps someone gets a chemotherapy regimen first and follow that with surgery afterwards, or we flip that and do it the other direction. And there's other ways we can cut out certain treatments or maybe add them on, knowing how it's going to behave based on that tumor's biology and how it looks under the microscope.
Okay, so you got breast cancer, and then what else would you say you treat a lot of?
Another more, unfortunately aggressive cancer we see is lung cancer. There is a unique and very small subset that can have these genetic drivers or mutations that maybe had led to the cancer in the first place, or maybe make it as aggressive as it is. And we can look at, right now maybe 6, 7, probably tomorrow will be more, of these genes that are now susceptible to medicines that you can take even by mouth.
Wow.
So an oral pill to keep your cancer controlled bypass a lot of the toxic effects of chemotherapy and really improve their overall survival.
And Dr. Gorden, what do you see as the future of personalized medicine?
So I see we have to sort through a lot of data. We generate a lot of genetic information on tumors. It's been extending into more an immune profile as well. And it's going to be trying to take all that data and hone it in on a treatment for each patient. And with that, we have always active research. It seems like new drugs are developed almost weekly, monthly, that's coming out. And these are finding new ways to find the weaknesses of the cancer and improve the outcome, decreasing the burden of disease, prolonging life, and again, improving quality of life because of less toxic effects.
And if somebody watching right now is curious to know more about personalized medicine, what should they do?
First place to start is reaching out to your healthcare provider if you have questions about that. And if you have more, you can reach us at saintalphonsus.org/cancer.
Wonderful. Thank you so much, Dr. Gorden.
All right, thank you.